The American Heart Association also has a large focus on stroke issues. Coincidentally, May is Stroke Awareness Month. We asked Tammy Albrecht to tell us about her work and what we should know about this issue. Now, Tammy is currently the Neuroscience Services RN Manager for Mid-Michigan Health. Tammy obtained her Master's of Science degree in nursing from Grand Canyon University in Phoenix, Arizona. She currently oversees the health system stroke program that includes the primary stroke center in Midland. Now, Tammy has more than 10 years of experience working with the stroke population. During this time, she developed a robust community outreach program, rural telestroke and teleneurology program that has a passion for preventative medicine that led to the development of this talk. So, welcome, Tammy.
Thank you for taking the time to join me today. My name is Tammy Albrecht, and I'm the Neuroscience Services Nurse Manager for Mid-Michigan Health. And the topic today is understanding stroke, and more specifically, stroke in women. When we say stroke, what we really mean is a brain attack, right? And the brain supports all functions of the body. So depending on how severe the injury to the brain and what part of the brain is affected, symptoms and outcomes can vary. While we all know strokes can happen to anyone at any age and vary in severity, type, cause, and effect, women and men are so very different, and their signs and symptoms and risk factors for stroke are as well. So my mission here today is to wake women up to the fact that stroke is a women's issue, and we can be part of the change and not the statistic, as 80% of all strokes are preventable. Stroke statistics. When we take a look at stroke data, we see stroke is now the 5th leading cause of death in the United States, which is roughly 1 in every 18 people. And while we have moved the dial when it comes to mortality, as just a few years ago we saw stroke as the 3rd leading cause of death, what is more staggering is that we still report that 2/3 of all stroke survivors have serious long-term disability, and 1 in 5 of them are not able to live at home after suffering from their stroke. Unfortunately, we've also seen a 50% increase in teen and young adult strokes in the last 10 years, and as of today, about 15% of all strokes occur in this population. We see this occurring in parallel with increasingly prevalent risk factors, most of which are based on lifestyle choices such as pregnancy, contraceptive use, excess alcohol consumption, low physical activity, and cigarette smoking, to name a few. 25% of all strokes are recurrent and end in worse functional outcomes. While the first 3 months following a stroke, or mini-stroke, which we call TIAs, is prime time for a recurrent stroke, the risk of recurrent stroke within the first year is 15 times greater than for the general population. For someone who survives a stroke or mini-stroke and is initially free of complications, the risk of experiencing another stroke, dying, or requiring admission to a care facility is doubled for up to 5 years following the initial stroke. Now let's break down the stroke data and look at what the numbers look like for women in stroke. You know how we talked about stroke being the 5th leading cause of death in the United States? Well, stroke is the 4th leading cause of death in women in the United States. That means about 425,000 women suffer from stroke each year, which is roughly 55,000 more than men. About 60% of all strokes suffered by women will end in death, as opposed to 40% of all male strokes. And to keep this in perspective, this doesn't just mean you have a stroke and then die. We're including those who suffer serious disability and eventually succumb, could be years, as a result of their stroke. If we look at African American women, stroke is the 3rd leading cause of death, as they suffer from a significantly higher number of strokes due to risk factors. Now, that being said, they are also less likely to correctly identify symptoms that cause a stroke, risk factors associated with stroke, and oftentimes do not seek immediate medical attention, comparatively speaking. Overall, the lifetime risk for women in stroke is 1 in 4 of us. Surprised? You're not alone. Many women do not know their risk of having a stroke, and while the facts are alarming, there is good news. 4 in 5 strokes, or 80%, are preventable. Now let's go back to stroke being a woman's issue. Number 1, that more women than men have and die from strokes. Stroke disproportionately affects women. Women's bodies are not the same as men, and stroke affects them differently, and they are at higher risk at key stages in their life. And we also know that this is partly due to women living longer than men. Number 2, twice as many women die from stroke as they do breast cancer. Today, only 27% of women can name more than 2 of the 6 primary risk factors. 70% of women have no idea they are more likely than men to have a stroke. Number 3, more women than men are stroke caregivers. The sudden nature of the disease often leaves families unprepared to deal with consequences, which include psychological and financial burden, along with the required physical care, which all culminate into excessive stress. This stress often leads to negative symptoms such as depression, anxiety, fatigue, social isolation, and major relationship issues. Lastly, number 4, women take much better care of others than they do themselves. Studies have shown fewer women seek early medical attention. We know that time is brain, and there's a very short window of opportunity to be treated for a stroke. Women also do not participate in clinical trial and research studies like men, and we tend not to identify with some of the more subtle symptoms that women can suffer from than men. So that brings us to discussion about the overall impact of stroke. As I already mentioned, stroke is a leading cause of serious lifelong disability, but is the number one cause of serious lifelong disability in women. Some of the more obvious include physical deficits, which affect motor control, such as our body movements. There may be paralysis, swallowing difficulty, or even balance issues. Many strokes affect the ability to speak intelligibly or express thoughts, and we know how frustrating it is when we try to get others to understand us when we communicate effectively. Imagine not being able to get your point across at all. We often see loss of sensation to touch, temperature, numbness, loss of bladder and bowel, and also chronic pain syndrome. So what does the burden on women really look like? Life after stroke brings about so much fear, anxiety, frustration, anger, sadness, and depression is very real. Women are already twice as likely to suffer from depression than men, and the number goes up when stroke is involved. Fewer women return home following their stroke, and more women end up in long-term care environments than men. More women suffer from marriage breakup post-stroke. That is when it's the woman who's had the stroke. The women tend to stay with the men who have suffered from the stroke. 2/3 of all stroke caregivers are women. Women provide more unpaid caregiving support, and an estimated 30% of them are family caregivers. Women caregivers spend 50% more time providing the care a male counterpart would. The demands of caregiver time are so substantial. The data shows that 33% of working women have to decrease their hours, 29% pass up job promotions, training, or assignments, 22% of the caregivers take a leave of absence, 20% switch to part-time, 16% have to quit their job, and 13% are forced to retire early. So you can see why women caregivers suffer from financial difficulties, social isolation, and are largely sleep deprived. The burden on women is real, but 80% of strokes are preventable. All right, so we've talked lots of numbers about our chances of having a stroke and dying from a stroke and having serious long-term disability from stroke. Let's talk about the ABCs of stroke prevention. A is for aspirin or anticoagulant. Often taking an aspirin as directed by your healthcare professional can significantly reduce the risk of having a stroke. B stands for blood pressure. Control your blood pressure. High blood pressure increases your risk for both heart attack and stroke or brain attack. Find out what your blood pressure numbers are and ask a professional what that means for your health and stroke risk. C stands for cholesterol. Cholesterol is the waxy substance produced by the liver and in certain foods. Your body needs cholesterol, but when you have too much, it can build up in your arteries and cause disease. There are different types of cholesterol, both good and bad. The good cholesterol can protect your body, where the bad cholesterol can increase your risk for stroke. If you do not know your cholesterol levels, reach out to a healthcare professional to get tested. And lastly, S stands for smoking. And we all know that smoking is bad for you, and it does significantly increase your risk of having a stroke. So how do we as women move the dial when strokes are 80% preventable? While some risk factors are outside your control, like race, age, and gender, there are many you do have the power to control, and we'll take a look at those 6 main risk factors now. Cholesterol, we've already talked about as part of the ABCs. We must know our cholesterol levels, low-density lipids, and triglycerides. We work with our healthcare professional to help us help ourselves. Maybe we need to watch our fatty diet, which is another of the 6 risk factors. Maybe we need to be on lipid-lowering medication. High cholesterol puts us at significant risk, as this usually doesn't cause symptoms, and many otherwise healthy people do not get regular well checks. Blood pressure. Knowing your family history is important, as this puts you at higher risk. Other factors include unhealthy diet, lack of exercise, and obesity. To lower your risk of stroke, try to lower your blood pressure to less than 120/80. The 120 or systolic represents the pressure as your heart is beating or pumping blood, and the 80 or diastolic is the pressure when your heart is at rest. Smoking. Quit smoking or do not start. There are many smoking cessation products out there to help if you're struggling. Smoking increases your risk of having a stroke by up to 4 times that of a non-smoker and does so in several ways. Number 1, it causes your blood to thicken and be more likely to clot. It can cause plaque buildup in the carotid arteries, which is a major artery that supplies blood to the brain. Nicotine raises blood pressure, and the carbon monoxide reduces the amount of oxygen your blood carries to your brain. Also worth noting, women who smoke and take hormonal birth control are at a significantly higher risk of having a stroke, especially when over 35. One of the 6 risk factors we haven't touched on is diabetes. Women with diabetes are more likely to die after a stroke than men with diabetes. Having uncontrolled diabetes can damage your arteries and also make you more likely to have high blood pressure. About 25% of people were completely unaware they had diabetes when they were initially diagnosed. Inactivity equals overweight equals increased chance of stroke, especially when weight is carried around the waist in apple-shaped people rather than hips and thighs and pear-shaped people. Overweight postmenopausal women are also at higher risk. Exercise and activity can actually help us address almost all other modifiable risk factors and lead to improved weight, lower blood pressure, improved diabetes, and lower cholesterol levels. Okay, so we've talked about what stroke looks like today, how we can identify with our own specific risk factors, but we haven't talked about what happens when we become part of this statistic and are having a stroke. We use a mnemonic or work association, BFAST. BFAST helps us to identify some of the most common stroke symptoms to watch for. B is for balance, a sudden loss of balance. E is for eyes. Have you noticed a sudden loss in vision in one or both sides? F is for face. Is there a sudden noticeable difference from one side of the face to the other, such as a droop? A is for arms. Is one arm weak or numb? S is for speech. Is there a sudden onset of slurred speech or inability to speak or a new level of confusion? And T is for time, and by far the most important thing to remember when you notice a sudden onset of any of the stroke symptoms listed above. Call 911. Stroke is a time-sensitive medical emergency. Do not take yourself to the hospital. EMS and paramedics are trained to identify, manage, and help facilitate quick response for treating strokes. The quicker we can get medical attention, the better our chances for a full recovery are. We've discussed the more a woman knows about her specific risk factors and about the signs and symptoms of stroke, the more she can focus on prevention. Women are really encouraged to schedule cardiovascular screenings beginning at age 25 to address risk factors, and Mid-Michigan Health offers a great way to get started on your path to a healthier you by offering a free quick stroke risk assessment. You can also reach out to stroke specialists via the email provided should you have additional comments, questions, or concerns about stroke and you. Lastly, thank you for attending this talk, and in summary, remember, a stroke is a brain attack, which is a time-sensitive medical emergency. It's important to know both the warning signs and how to manage the ABCs of stroke prevention. And remember, healthy habits are important, and 80% of all strokes are preventable.
Thank you so much, Tammy, for that information on stroke. And I heard you say it about 3 or 4 times, and it bears repeating one more time that 80% of strokes are preventable. So that is such great news. Thank you for giving us the warning signs, the preventable ways that we can act, and things that we can do to prevent this from happening. And it's very helpful to also know that we have to act quickly in the event of a suspected stroke. So thank you so much once again, Tammy, for that.